Hi everyone, myself Dr. Ayesha, Department of Pathology, Narayana Medical College, Nellore. Today I am here in front of you all on the event of World Thalassemia Day, which is celebrated on May 8th of every year. Thalassemia is an inherited disorder of the gene leading to hemoglobin synthesis. This defective gene passes on from parents to the children. Because of this defective gene, there will be ineffective erythropoiesis. Depending upon the defect of the gene, depending upon the quality of the gene defect, this thalassemia is of beta thalassemia and alpha thalassemia. Depending upon the quantity of the defective gene inherited, this thalassemia is again of thalassemia major and as well as thalassemia minor. Normally, the thalassemia patient's bone marrow produces the normal amount of RBCs, but these RBCs are qualitatively defective so that they will be destroyed in the bone marrow and some RBCs are destroyed in the spleen. Because of the destruction of RBCs, there will be anemia, splenomegaly, as well as characteristic chipmunk faces, also known as mongoloid faces in children. Thalassemia minor patients generally do not have any symptoms. On routine investigations, they found out to have milder degrees of anemia. Whereas thalassemia major patients are protected till 6th month of life by fetal hemoglobin. From 6th month onwards, when fetal hemoglobin starts decreasing and there is production of adult hemoglobin, there is severe anemia, splenomegaly, growth retardation, and delayed milestones will be seen in the thalassemia major patients. The clinical diagnosis is by the clinical pictures of the patient, whereas the diagnosis of the patient is by complete blood picture, peripheral smear examination and hemoglobin electrophoresis. The complete blood picture of thalassemia minor patients shows mild levels of anemia. The thalassemia major patients will have moderate to severe degrees of anemia. The peripheral smear examination of thalassemia minor patients shows microcytic hypochromic RBCs. These RBCs are similar to the RBCs seen in iron deficiency anemia. On doing iron studies, the iron deficiency anemia patients have decreased levels of iron, whereas thalassemia patients will have normal or increased levels of iron. Thalassemia major patients have microcytic hypochromic RBCs. Along with that, there will be target cells which are morphologically abnormal RBCs and many number of nucleated RBCs. But definitive diagnosis of thalassemia requires hemoglobin electrophoresis. The hemoglobin electrophoresis shows decreased levels of adult hemoglobin, whereas elevated levels of HbA2 as well as fetal hemoglobin. The treatment of thalassemia patients is thalassemia minor patients generally do not require any treatment because they have some amount of normal adult hemoglobin. The thalassemia major patients require repeated blood transfusions, iron chelation therapy and folic acid treatment. The prevention of this thalassemia is by premarital counseling, genetic counseling and by prevention of the consanguineous marriages. Thank you.